Hello friends, welcome to our YouTube channel Gurukul Learning. In today's video we are going to start new subject, that is pharmaceutics part 1, which is a part of B Pharmacy first semester, and this will be also useful for D Pharmacy students. Content to be covered in this video are: first, introduction to pharmacy; second, history of pharmacy profession in India; third, history of pharmacy profession in India in relation to pharmacy education, industry, and organization. First of all, let us know that what is pharmacy, so let's start. Pharmacy is a healthcare profession that involves the study, preparation, dispensing, and management of medications and drugs to ensure safe and effective use by patients. Pharmacists, who are licensed healthcare professionals, play a crucial role in the healthcare system, collaborating with other healthcare providers to optimize patient outcomes through proper medication management. Key aspects of pharmacy are: 1. Street medication dispensing. Pharmacists dispense prescription and over-the-counter medications to patients, ensuring that they receive the correct medications in appropriate dosages. 2. Medication counseling. Pharmacists provide valuable information and counseling to patients about the proper use of medications, potential side effects, drug interactions, and ways to improve medication adherence. 3. Medication management. Pharmacists work with healthcare teams to review patients' medication profiles, identify potential drug-related problems, and make recommendations for optimizing drug therapy. 4. Compounding. In some cases, pharmacists may prepare customized medications by compounding individual ingredients to meet specific patient needs. 5. Medication safety. Pharmacists are responsible for verifying the accuracy of prescriptions, checking for potential drug allergies or contraindications, and ensuring that medications are safe and appropriate for each patient. 6. Drug information. Pharmacists are a reliable source of drug-related information for both patients and other healthcare professionals. They stay updated on the latest drug developments and provide evidence-based information. 7th. Pharmaceutical care. Pharmacists practice pharmaceutical care, a patient-centered approach to optimize medication therapy and improve patient outcomes while minimizing drug-related problems. 8th. Health promotion. Pharmacists promote public health by offering services such as immunizations, smoking cessation support, and health screenings. In short, pharmacy encompasses a broad range of settings, including community pharmacies, hospitals, clinics, long-term care facilities, pharmaceutical industries, research institutions, and academia. The field of pharmacy continues to evolve with advancements in medical science and technology, playing a vital role in the healthcare system and patient well-being. Now the next is history of pharmacy profession in India. The history of the pharmacy profession in India dates back to ancient times, where traditional systems of medicine were prevalent. India has a rich heritage of herbal and medicinal practices, and the art of pharmacy was an integral part of this ancient knowledge. The timely evolution of the pharmacy are given. During ancient times, the roots of Indian pharmacy can be traced back to the Vedic period, 1500 BCE to 600 BCE, where Ayurveda, an ancient system of medicine, was established. Ayurveda relied on natural remedies and herbs for healing purposes. During this period, knowledge of medicinal plants and their properties was documented in texts like Charaka Samhita and Sushruta Samhita. During Mauryan and Gupta periods, the Mauryan, in 321 BCE to 185 BCE, and Gupta, 320 CE to 550 CE, periods marked significant advancements in the field of medicine and pharmacy. The renowned physician Charaka and surgeon Sushruta were pivotal figures during this time. Their works contributed to the development of Ayurveda and the establishment of formalized practices for preparing and dispensing medications. During Islamic influence, from the 8th to the 12th centuries, India saw an influx of Islamic knowledge and culture. Unani medicine, which originated from the Islamic world, gained popularity during this period. Unani medicine incorporated Greek, Persian, and Arabic elements and introduced new medicinal plants and preparations to the Indian pharmacopoeia. During British colonial era, the arrival of the British in the 17th century had a significant impact on the Indian pharmacy profession. The British brought their own medical and pharmaceutical practices to India, and they established Western-style medical colleges that taught modern medicine. They also set up the first Western-style pharmacy schools, which laid the foundation for formal pharmaceutical education in the country. During establishment of pharmacy education in 1822, the Calcutta Medical College started offering courses in materia medica, study of medicinal substances, and dispensary pharmacy. Subsequently, other medical colleges and institutions across India started incorporating pharmacy education into their curriculum. Now the next is Pharmacy Act of 1948. After India gained independence in 1947, the government recognized the need for regulating the pharmacy profession. The Pharmacy Act of 1948 was enacted to regulate the practice of pharmacy and to establish the Pharmacy Council of India, PCI, as the regulatory body for the profession. 7th. Modern pharmaceutical industry. Post-independence, India witnessed a boom in the pharmaceutical industry, several Indian companies started manufacturing and marketing pharmaceutical products, and the country became a major player in the global pharmaceutical market. 8th. Advancements in globalization. Over the years, the pharmacy profession in India has continued to evolve with advancements in technology, research, and education. Indian pharmacists have also become an essential part of the healthcare system, ensuring the safe and effective use of medications. Today, the pharmacy profession in India continues to grow, with a focus on providing quality healthcare services, research and development of new drugs, and promoting traditional systems of medicine alongside modern pharmaceutical practices. The Indian pharmaceutical industry is one of the largest in the world and plays a vital role in meeting the healthcare needs of the nation and exporting medicines to other countries. Now the last is history of pharmacy profession in India in relation to pharmacy education, industry and organization. The history of the pharmacy profession in India is closely intertwined with the development of pharmacy education, the growth of the pharmaceutical industry, and the establishment of pharmacy organizations. Let's explore each aspect in relation to the history of pharmacy in India. History of pharmacy profession in India in relation to pharmacy education. First, during ancient times, in ancient India, knowledge of medicinal plants and herbal remedies was passed down through oral traditions and written texts like Charaka Sanhita and Sushruta Sanhita. This informal system of education continued for centuries. Second, colonial era. During British colonial rule, Western-style pharmacy education was introduced in India. The Calcutta Medical College, founded in 1835, offered courses in materia medical and dispensary pharmacy. Subsequently, other medical colleges in various parts of India incorporated pharmacy education into their curriculum. Third, Pharmacy Act of 1948. After India gained independence, the Pharmacy Act of 1948 was enacted to regulate the pharmacy profession and education in the country. The Act established the Pharmacy Council of India, PCI, as the regulatory body for pharmacy education and practice. Fourth, modern pharmacy education. In the post-independence era, pharmacy education saw significant advancements. Several pharmacy colleges and institutes were established across the country, offering diploma, bachelor's, B. Pharm, master's, M.Pharm, and doctoral, Pharm, D. degrees in pharmacy. The curricula expanded to include subjects like pharmacology, pharmaceutical chemistry, pharmaceutics, pharmacognosy, and pharmacy practice. Next is history of pharmacy profession in India in relation to pharmaceutical industry. First, pre-independence. Before independence, the Indian pharmaceutical industry primarily consisted of small-scale traditional units that produced herbal and Ayurvedic medicines. However, the industry was not highly developed during this period. Second, post-independence growth. After independence in 1947, the Indian pharmaceutical industry began to witness significant growth. The government encouraged the production of essential drugs and medicines to meet the healthcare needs of the nation. Several Indian companies started manufacturing generic pharmaceuticals and became major players in the domestic market. Third, patent law reforms. In the 1970s, India implemented patent law reforms that allowed the production of generic versions of patented drugs, which further boosted the growth of the pharmaceutical industry. Indian companies began exporting generic medicines to other countries, making India a global player in the pharmaceutical market. Fourth, modern pharmaceutical industry. Today, India is one of the largest pharmaceutical producers in the world. The industry has diversified to include not only generics but also the development and manufacture of complex formulations, biopharmaceuticals, and active pharmaceutical ingredients, APIs. Now the last in this two piece is history of pharmacy profession in India in relation to pharmacy organizations. First, Pharmacy Council of India, PCI. Established under the Pharmacy Act of 1948, PCI is the apex regulatory body for pharmacy education and practice in India. It sets standards for pharmacy education, approves institutions offering pharmacy programs, and regulates the registration of pharmacists. Second, Indian Pharmaceutical Association, IPA. Founded in 1939, IPA is one of the oldest and largest professional organizations of pharmacists in India. It represents the interests of pharmacists, promotes professional development, and fosters research and collaboration within the pharmaceutical industry. Third, Association of Pharmaceutical Teachers of India, APTI. APTI, founded in 1966, is an organization dedicated to the development of pharmacy education in India. It provides a platform for pharmacy educators to exchange ideas and promote excellence in teaching and research. Fourth, Indian Drug Manufacturers Association, IDMA. IDMA is a national association of Indian pharmaceutical companies, advocating for the interests of the pharmaceutical industry, promoting research and development, and addressing industry-related challenges. Fifth, Pharmaceuticals Export Promotion Council of India, PharmExcel. PharmExcel is a government organization responsible for promoting Indian pharmaceutical exports worldwide and facilitating international trade in pharmaceuticals. In summary, the history of pharmacy in India reflects the growth and evolution of the profession, from traditional herbal practices to a modern and vibrant pharmaceutical industry. Pharmacy education, industry, and organizations have played crucial roles in shaping the landscape of pharmacy in the country and contributing to the well-being of the nation's healthcare sector. Thanks for watching this video.